So in today's insurance-driven, insurance-based medical system that we have in the United States, one of the main issues with primary care is access and time with your primary care physician. So we know from study after study and people's own experiences that having time with a primary care physician is so key to getting the best outcomes and feeling as comfortable as possible, sharing goals, vision, and desires, and really making sure people are hitting those meaningful outcomes. So with insurance, we have now built a system where most patients get somewhere in the order of 7 to 12 minutes with their primary care physician, often to address a laundry list of issues. Those 7 to 10 or 7 to 12 minutes might be next month, might be 3 months from now. And in Massachusetts, the average wait to get in to see your primary care physician for a new patient appointment is up to 6 months. And when you do get in to see that physician, sometimes they're so harried and so busy that you feel that their agenda is the only one that's important, and you don't get a chance to really address the issues on your plate. We're told that our insurance is going to take care of us. We're told that our insurance is going to cover the things that matter. But the reality is that insurance is not the same as care. Insurance gets you the bare minimum these days, and you're worth more than that. Here's the situation. The bare minimum is not okay. The bare minimum of primary care in today's world is all about hitting metrics that are mandated by insurance carriers and large medical practices for primary care physicians to hit. Numbers like blood pressure, numbers like cholesterol, numbers like hemoglobin A1C for our diabetic patients, things that really all about treating the chart and treating the number, not treating you. Let's face it, if you've ever been in a system like this, you know how this feels. It feels like you're a number. Because unfortunately, as much as all of us as primary care physicians go into this field to give you the best care and make the most connections, there are such restrictions and limitations on how much time we can spend and how much we can connect with you. So inevitably, you are a number. Unfortunately, it's not the primary care physician's fault. It's the system. This system leads to disenchantment, disenfranchisement, and significant frustration to the point where a lot of people don't even bother going to see their primary care doctor because they're not getting that relationship, they're not getting that care, they're not getting that understanding that they need, and they just end up either ignoring issues, letting issues fester, looking online for solutions, or ending up in the emergency room or urgent care for very fractured care. At Infinity Health and Body, we have been offering for many years a direct patient care program for primary care. This is concierge level care for you, where you get to know me as your primary care physician and my team so that we're available to you 24/7, 365 days of the year for emergency issues and throughout the day or throughout the week for less urgent issues that can be addressed either through text messaging, through video visits, or through email-like platforms that are HIPAA compliant. Now, this is really important because in the traditional system, we have to see you in order to bill your insurance company. And a lot of things don't require an in-person visit. We learned this over the last couple of years through the COVID pandemic, where all of a sudden telehealth became so popular. We've been doing that through our concierge level primary care program for 7 years now. It's part and parcel of the care that we give you, whether you're on vacation in Florida and need some questions answered about a rash you might have, whether you're just down the street and need some medication adjustments that don't require you to come in, whatever it might be, even if it's just being at the pharmacy and asking for guidance about some over-the-counter remedy that you're not sure what to get, we're available to you to make sure you have that proper guidance when you need it. In addition, when you do come in to see us, we have unhurried 30 to 45 minute appointments with us so we can really dig down and address the root cause issues for whatever might be bothering you. At Infinity Health and Body, our concierge level primary care is not about better living through chemistry. It's not about just rearranging prescriptions or changing doses. It's really about trying to get to the underlying issue so that you're better next year, not just better tomorrow, where something's going to slip back after a little while. It's really about focusing on you, the patient, and what's important in your life. We get to know your family, we get to know your history, we get to know the things that are important to you, your goals, your dreams, your aspirations. And it's much more about a one-to-one relationship where we work for you and your goals are our goals. Very, very different than a traditional system, and it's worked. What we see at Infinity Health and Body with our concierge level primary care is that when you engage with us on those goals that are meaningful to you for your true health outcomes, we find that our patients are more invested in their health, they're more engaged, they're more likely to stick with the plans that they and we jointly come up with. Typically, we see a significant reduction in doctor's visits, in hospital visits, in specialty consults, and even medication utilization. Because at the end of the day, my job and our entire team's job is to teach you how to help take care of yourself, not to just have you come in visit after visit. We're here when you need us, but our goal is for you to live your best life outside of our office. As an example, let me tell you about my patient Bob. Bob's about 58, 60 years old, chronic low back pain, and was on pain medications for a number of years through his primary care doctor in another practice. He and I sat down and we decided together that his goal was to get off the pain medication and get the best relief elsewhere for his back pain without drugs. We've been working on this for a while, and unfortunately he had some issues getting off the medication and ended up getting hospitalized over Labor Day weekend several years ago. The patient reached out to me through our secure messaging system, and I was able to intervene with the hospital's plan of care so that they understood Bob's goals and didn't just put him back on the medications that would have set us back probably 3 to 6 months. The outcome took a little bit of extra work, but it was worth it in the end because we were able to keep him on track with Bob's goals, not the hospital's goals and not my goals, but Bob's goals. And that's really at the end of the day what matters most. Now that we've covered how this works, down below, there's some more information on what we just went over. If it makes sense and you'd like to see if you're a good fit for care with us, I want to personally invite you to schedule your new patient discovery call. You will get complete clarity on these few key things on this call: roadblocks and obstacles, goals and outcomes that you want, comprehensive in-office testing and evaluation we offer here at Infinity Health and Body, and making sure that we are a relationship fit, that you are excited to work with me and vice versa. If that sounds fair, go ahead and click Start Your Journey, and we'll get that patient discovery call scheduled. My name is Dr. David Cunningham, and I look forward to serving you. Thank you for your time and attention.